All right, so quickly looking at another concept in gynecology. So this is an informed consent form in gynecology. So informed consent, literally, you just have to do it. You want to actually do something to a patient. So before I do this thing to a patient, I'm trying to actually ask for the consent of the patient. The patient should actually agree and fully show that they understand what I'm about to do to them. It's usually surgery or something, and the side effects and all. They understand it before we proceed. Now, this is to come and avoid all those lawsuits that usually come up in gynecology. So you just have to do it. It's a foundational ethical legal process. It ensures that what the patient understands and voluntarily agree to medical procedures or treatment. Do you understand? So if we are saying there is a form, the most important part is you're actually looking at what the elements that are in the form, okay, so that the patient could actually read and show fully that they understand what's happening. So it's not just about signing a form. It's about empowering patients to be able to make decisions that align with their own values, preference, and health goals. So core principles: autonomy. It respects that patient's right. Disclosure. You explain everything very clear to the patient. Understanding. It ensures that the patient has 100% understanding of what you're about to do. Voluntariness. So, you shouldn't compel the patient to say yes to something. Everything should actually go on smoothly. Competence. So patient must be what? Mentally capable. You shouldn't ask a patient that has problems with thinking and all of that to actually make a decision. So when is it required in gynecology? All right, surgical procedures, invasive diagnostics, obstetrics interventions, contraceptive methods, pelvic examination under anesthesia. So all these things that are about to actually change a part of the body of someone. Do you understand? You must actually be with their own consent. So things that you might actually need to discuss in that form include the diagnosis, right? So what was the problem, all right, that led to you wanting to do a procedure? All right, you talk about the procedure, how it to be done, talk about the risks and benefits, talk about alternatives. That's to make sure that you told the patient about other alternatives, all right, but the patient actually had to go for this, all right. The consequence of refusal. What would have happened if the patient rejected it? All right, then who will perform it? The name and the role of the clinicians or surgeon should actually be indicated there. So it helps us to actually build trust, improve satisfaction and outcomes, reduces any regret that usually come up after procedures, because both parties actually agree to go for it. All right, so that's it.